Hi everyone, welcome back to Global Academy of Medical Education. Myself Dr. Padmanabha, TS, Faculty of Pharmacology at Global Academy of Medical Education. So in this short class, let us understand the importance of carbapenems and their related important topic that has been asked in your examination. So carbapenems are the wide spectrum antibiotics. Please remember carbapenems, they have got wide spectrum of activity. Wide spectrum of activity, and under these carbapenems you have drugs which are ending with penems. So which are all those drugs? You can remember with, we have imipenem, you have got imipenems, you have got meropenem, you have got ertapenems, you have got doripenem, you have got pharopenems. So you got imipenem, meropenem, ertapenem, doripenem and the pharopenems. And please remember, this meropenem, ertapenem and doripenem do not undergo hydrolysis with which enzyme? Renal dihydropeptidase 1. But this imipenem will be degraded by renal dihydropeptidase 1 enzyme. So thereby what happens? There will be decrease in the concentration of imipenem. To increase the imipenem concentration, you may need to give a drugs which can inhibit the renal dihydropeptidase activity. So the drug is cilastatin. So cilastatin is a drug which will going to inhibit the renal dihydropeptidase, thereby it increases the imipenem concentration. So apart from that, I should also remember that Faro is the only carbapenem which is given by oral route. And please remember, ertapenem, they are longest acting as well as they are not effective against pseudomonas, but meropenem will be most effective against pseudomonas. And whenever you are giving these drugs in the treatment of pseudomonas, you need to combine with the amino glycosides for effective action. So as we said earlier, what do you mean by wide spectrum? So it can cover gram positive cocci, it can cover gram negative rods, as well as anaerobic infection. And these carbapenems, they are the drug of choice for extended spectrum beta lactamase producing organisms. So they are the drug of choice for extended spectrum beta lactamase producing bacteria. So which is the most common side effects which is caused by the imipenem? So imipenem when combined with cilastatin, so the advantage is cilastatin will going to inhibit the renal dihydropeptidase 1 activity. Thereby what happens? It increases the imipenem concentration, and at the same time it will increases the risk of seizures. It increases the risk of seizures. So risk of seizures is not seen with these drugs, and here you can remember there is no risk of seizures with med drugs, that is meropenem, ertapenem and doripenem. So these are the very important things you should remember from the carbapenems. So just to write it, so imipenems, since it will be degraded by renal dihydropeptidases to inactive metabolite. So you can increase the concentration of imipenem by inhibiting this drug with the help of cilastatin. So you can combine cilastatin with the imipenems. Only the risk involved with these drugs is it will going to increase the risk of seizures. So which is the drug which is given by the oral route here? Here you have got pharopenem, and they are the drug of choice. Carbapenems are the drug of choice in case of extended spectrum beta lactamase producing organisms. And ertapenem is long acting as well as not effective against pseudomonas, but most effective will be the meropenem. And all three drugs, MED is not degraded by renal dihydropeptidase 1, especially the renal dihydropeptidase 1, thereby no seizure risk. So this was about the class on the carbapenems. So please remember, most of the time they have asked why cilastatin is added to imipenem. So this will be the MCQ. The reason being, which enzyme is inhibited? Renal dihydropeptidases. Again, very important. So what is the risk involved? It increases the risk of seizure. So the drug of choice in case of the extended spectrum beta lactamase producing organisms, and the long acting will be the ertapenem, orally pharopenem, and seizure is not seen with the med drugs, and most effective against pseudomonas is the meropenem. So please remember this, and this is very important topic that can be asked in your exams. Thank you.